Welcome viewer, Assalamu alaikum wa rahmatullah. Today I want to discuss about muscular dystrophy in brief. The muscular dystrophy are a group of inherited genetic conditions that gradually cause the muscles to weaken, leading to increase the level of disability. Muscular dystrophy is a progressive condition which means it gets worse over the time. It is X-linked recessive inheritance. Male affected and female carrier. Female has two X chromosomes, one if affected, other the compensate. But in male, only one X chromosome and another Y chromosome. So X chromosome if affected, the male are affected. Duchenne muscular dystrophy, the dystrophin gene is the responsible. It is non-functional due to genetic condition. The deletion of exon 50 is produce the loss of muscle integrity and non-functional dystrophin gene. This protein loss of muscle structure and function. We know the contraction of the muscle, actin, myosin by calcium and ATP. So actin and myosin, the contraction period close to each other, and when sliding forwards, it go relaxation. The muscle contraction and relaxation, this is lost in muscular dystrophy because muscle are lost, atrophy and destroy. Muscle weaken and wasting and difficulties with walking, running, climbing stairs, rising from ground, and frequent falls, not being able to jump, bulky calf muscle, minor learning difficulties. In incidence 1 in 3,500 male birth, untreated boy become wheelchair dependent by the age of 12 and die in their 20s up to 30, often due to respiratory and cardiac complication due to cardiomyopathy. This is the muscle, whole of the body muscle, contraction, relaxation, and activity. Our movement depends on the muscle activity. Who are muscle activity good, they can heavy weight they can lift. This is the goer sign. To stand up, need help of the upper limb and knee support. Within 1 to 5 years, the develop word sign and history of motor development delay, frequent fall, and difficult climbing stairs, waddling gait, ambulation frequently impossible by the age of 12, and breathing muscle become more affected, life-threatening infection are more common, equally lead to death. In basic, this average lifespan 25 years to 30 years and 3 to 5 years it can be diagnosed. The 1 in 5,000 male birth affected and genetic killer number 1 of the boy. 35% random spontaneous mutation at birth. At the age of 12 years, the skeletal muscle degeneration and wheelchair bonded and cardiac and respiratory dysfunction ultimately. All the muscle are degeneration. Cup muscle thicken and is false hypertrophy, and the muscle replaced by fat and not contraction good. Muscle protruding on the belly sticks out due to weak belly muscle. Thin, weak thigh, especially in front part. Poor balance, fall often, occurred, clumsy if walking. Weak muscle in front of the leg, foot drop, and tiptoe contraction. And different joint contraction, unable to walk. And different age group, different condition. This Becker muscular dystrophy about 10%, and Duchenne muscular dystrophy 23% total muscular dystrophy. And other type facioscapulohumeral dystrophy, limb girdle muscular dystrophy, congenital myopathy, myotonic dystrophy, congenital muscular dystrophy, spinal muscular dystrophy, hereditary neuropathy. So at the age of 5 years, it is diagnosed. In different country, the different number of patients, and ultimately the patient invasive and non-invasive ventilation. So by investigation electromyography, we can differentiate the muscular dystrophy and disease which damage the neuromuscular junction, myasthenia gravis, and lower motor neuron lesion, the peripheral neuropathy, upper motor neuron lesion, the anterior horn cell degeneration, damage of anterior horn cell, all the patient Duchenne muscular dystrophy. So ultimately, the heart failure due to cardiomyopathy. Investigation of muscular dystrophy by electromyography, muscle biopsy, and creatinine kinase is markedly elevated. The patient Duchenne muscular dystrophy regular follow-up for respiratory function, cardiac function, and to follow up the height, weight, and bone density, CT scan of the bone age determination due to corticosteroid side effect to maintain. So Duchenne muscular dystrophy, it is a progressive disorder. The nerve conduction test and electromyography. So always the cardiomyopathy develop and cardiac failure. Treatment Duchenne muscular dystrophy approval, FDA approval, will tolerance, will tolerance for treatment of Duchenne muscular dystrophy. It is a disease-modifying drug, and gene therapy, cell therapy, and pharmacology therapy, gene editing, and stem cell, and multidisciplinary team, muscle biopsy, follow, and physiotherapy. Thank you very much for watching. Please subscribe, share, health education for well-being of mankind. Thank you.